I decided to become a midwife after meeting one during my annual exam. And then I started doing research about midwifery and just fell in love with the women's health, the empowerment, the education aspects of the type of care that midwives provide. One of the biggest misconceptions is that midwives don't work in hospitals, but actually the majority of midwives in this country do work in hospitals.
I like working with the midwives because I think they are true examples of dedication to their patients. They'll come in at odd hours, they'll stay up all night with the patient, not just when they're pushing, but during the whole time of their labor. I think that they're models of what should be the connecting piece with a provider and the patient. I think from a patient point of view, midwives bring a certain intimacy and an emotional connection that patients really value when they're having something as life-altering as a birth.
I typically take care of low-risk women. We do lots of family planning, lots of annuals, menopause. We do everything. Women through the lifespan.
I was not aware of everything that Houston the Midwife would offer. However, as once the appointments continued to go, I learned of the full array of services that they offered, not only to me, but to my family.
My midwifery practice has a great relationship and works well with doctors, so it made me feel good to know that if a complication were to arise, they would be able to work together for the best possible outcome.
I was diagnosed with a twin pregnancy when I was about 12 weeks pregnant. Having Ebony and Dr. Freeze collaborating gave me a great peace of mind. I felt like I was receiving the care that I needed with a twin pregnancy, but also receiving the care that I wanted with a midwife. They were both on the same page, and every time I came in for a visit with Ebony, she had all of the information from Dr. Freeze.
A lot of women love coming to midwives for hospital birth because when she's admitted, we do some entry monitoring, but then we do intermittent auscultation, which means that we listen to the baby periodically. We do not do continuous monitoring. We don't do running IV fluids. We just have IV access, and we allow women to walk around the room. She can utilize the shower. She can get in any position that makes her feel comfortable, which I think is very important.
One of the myths that I heard about midwives was that you couldn't have any sort of pain relief. They didn't do any sort of prescriptions or drugs at all.
I'm very proud to say that women can come, and even if she comes in and her plan was to have an unmedicated birth and she wants pain medication, she can have it. Being with a midwife doesn't mean exactly unmedicated birth. It means being with a woman in whatever way she decides to birth.
I would definitely encourage a friend to try a midwife at a hospital. I feel like midwives can provide the type of care that you could be looking for, but still work in a hospital environment where a lot of people are comfortable.
What I would say to a mother who's thinking about having a baby in the hospital with a midwife is great choice.